So my mom, Harriet DeWolf, actually broke her shoulder at 76. Now, at that time, she had moved to Washington from the Bay Area, and she was on a small island called Whidbey Island. And she actually was in a standing position and broke her shoulder. And then she'd also lost 3 inches of height. So she was starting to bend over a bit, you know how that happens. And those are both signs of osteoporosis.
Osteoporosis, or low bone mass, is a condition where your bones get weak with age and are easily broken. It is one of the most common chronic health conditions in America, but it doesn't have the same level of awareness as some of the other conditions, such as cancer or heart disease. So most people don't realize how widespread and how serious it can be. About half of all women and a quarter of all men over the age of 50 have osteoporosis or low bone mass and are at risk for having bone fractures. Osteoporosis is often undiagnosed because it's a silent condition. Most people who have it don't even know they have it until after their first fracture.
So at 78 years old, she actually fell in the bathroom in the middle of the night and broke her left hip very badly after recovering from knee surgery. So as she was recovering within that 2-month period, she ended up breaking her other hip. Now this is actually very common, unfortunately. This was extremely traumatic for her. She was on the middle of the kitchen floor sobbing with her husband holding her, trying to comfort her. And as she was lying there, she's thinking, that's it, I'm never gonna walk again.
After a hip fracture, 25% of women will die within the first year, and that number is even higher for men. And of those who survive, 60% will never regain their previous level of independent functioning, and they'll need assistance with daily activities such as walking or getting dressed. While there is no cure for osteoporosis, there are many things you can do to prevent fractures. These include weight-bearing exercise, getting enough calcium and vitamin D every day, stopping smoking, limiting alcohol, and preventing falls.
My name is Steph, and I have osteoporosis, and I've had it quite a few years, 20 years to be exact. I take calcium and a multivitamin and let's see here, lots of activity. I decided to do the things that I most love, and that was continue walking. I got into line dance, square dance, and ballroom dance, and I did some yoga and stretches, and which included weightlifting and bands.
The most effective thing you can do to lower your risk for having fractures is to take an osteoporosis prescription treatment if your doctor feels it's right for you. These medications have been used for decades by millions of people worldwide, and they can lower your risk for fractures by up to 50%, which is really amazing.
I had no adverse effects from taking the medication, no concerns. The only thing that changed in my life was that I needed to get into a habit of taking the pill once a week.
Most people have little to no side effects when they take these medications. Some of the mild side effects you can expect may include acid reflux, such as heartburn, or very limited and mild bone aches, which go away by themselves and are completely harmless. Serious side effects are extremely rare, on the order of 1 in 10,000.
So May's help and information really was a turning point for us. And basically, they gave her a treatment, and she actually fell a couple times after just 9 months of her first treatment. And luckily, she didn't break a thing. And so she is thrilled that this treatment is working, and she has a semblance of life returning to somewhat normal. Now, it will never be the same. And I keep thinking, you know, what if she had been a Kaiser member and we could have given her that medication early and built up those bones? She may never have ever had to go through any of that trauma.
The most important thing for you to do now is to know your own personal risk for having fractures. Talk to your doctor about your fracture history, or if it's time for you to have a bone density test. All these things will help them decide the best plan for you for preventing fractures, which may include taking a medication or other lifestyle changes.
You know, you get out of it what you put into it, right? So for patients who really have that rapport and that trust with their doctors, and they follow the advice and they're proactive about their health.
Your healthcare team here at Kaiser Permanente is here to support you and to give you resources and knowledge so that you have the best chance of preventing fractures.
If you have osteoporosis, you've got to be on the alert. It's not a matter of being afraid, it's a matter of being smart. And I'm just filled with gratitude every single day of my life that I'm here and that I can do it. And I can do it now, and so I'm gonna do it now.
Thank you for watching this video about osteoporosis and low bone mass. Learn more about how you can prevent fractures by going online to kp.org and speaking with your physician about learning what your personal risk for having fractures is.